Professor Francis Kasolo, thank you for talking to us here on Joy News. It's a pleasure to be with you.
Thank you very much for inviting me to your program, and it's always a pleasure to have journalists to talk about the issues of health in Ghana and globally.
We've been waiting for this moment, and it's much more of a joy for us here on our side, because we're speaking to you knowing that you work with an organization that's been set up some 75 years ago. You're dedicating the 75th anniversary of the World Health Organization this time around to pushing further the agenda of achieving universal health for all. At the launch of this 75th anniversary, you've been doing your own anniversary launch here in Ghana. You made a very important point: the need, first of all, to reflect on the years past and also to build together, looking into the future. Looking back at the years, you might not be, of course, there at the start of it 75 years ago, but looking back over the years, joining the health organization and looking at where it is heading to, what reflections personally have you made, and how do we move forward together in making the world a safer place for all?
Well, thank you very much again. And as you've rightly mentioned, the World Health Organization was set up on the 7th of April, 75 years ago. And this was just soon after the Second World War, when not only the economic systems, but also the health systems had been shattered by war. And so in setting it up, the United Nations, to whom we belong, gave WHO a mandate that can be summarized as 1, promoting health, and 2, protecting the world and saving the vulnerable. Through this mandate, the World Health Organization over the last 75 years has invested time and its human resource to help the globe at least achieve some of these things. And for example, if we look at areas of promoting health, and this is where universal health coverage and primary health care discussions come in, you will see that over the past 75 years, access to health across the globe has improved at an acceptable amount of money. In other words, people are no longer paying a lot of what we'd call out-of-pocket money to access health. That in part has been due to WHO working very closely with member states to design health systems that allow for that to happen. Secondly, one of the areas that WHO has invested time and resources in is developing human resource capacity for health. And I'll give an example that in some countries at the time of independence, they hardly had the adequate numbers of nurses, doctors, pharmacists, and technicians, and so on. But through collaboration with the World Health Organization and setting standards for training and evaluating performance of health workers, most countries have attained great numbers in terms of the health workers that are accessing or supporting the delivery of health system. When we turn to the issue of protecting the world, which is really making the world safe. You saw recently there was the COVID-19, and WHO's role was central in trying to coordinate the response, the global response, ensuring that the right medical products and the quality of the medical products that were being put on the market, including the vaccines, were appropriate and safe for use. We have in the past also protected the world by really leading what we call eradication programs, such as smallpox eradication. Smallpox had devastated the world, killing a lot of people. But through the work and leadership of the World Health Organization, appropriate vaccines were developed, introduced, rolled out, and now we hardly hear of smallpox. Polio is the same in Africa, that a few years ago, the African region was declared free of wild polio virus. So again, these are all work that WHO has been working with member states, with partners, but also the community to protect the community. And lastly,
yeah.
the area, the second mandate related to what we call protecting the vulnerable.
Yeah.
And in this area, it's not traditional what we call a medical area, but it's really looking at the determinants of health, things that contribute to ill health. So for example, we are now working in areas of climate change and health. We're working on areas such as tobacco, and you may know that the WHO was instrumental in getting member states adopt what we call the Framework Convention for the prevention of Framework Convention on tobacco control. This convention puts into place measures that reduce what you'd call the inhalation of tobacco fumes or use of tobacco and tobacco products to reduce its effect on, for instance, the lungs and subsequently causing lung cancer. So there is a lot that WHO has done.
There's a lot happening, and what an interesting journey it has been. It just appears that, you know, the COVID-19 pandemic has blighted all of the achievements that you've made over the years. Do you share the same view?
Well, yes, it's really I would say that COVID-19 came at a time, and looking at it to test whether or not our health systems were strong enough to withstand shocks. Yes, we have had significant negative impact of the COVID, not only economically, but also on the health sector. During the peak of COVID, for example, a lot of essential services had closed down. So things like antenatal care, immunization services, they were really at the lowest. And indeed, the systems itself, the whole health system was tested. But I'm happy to work that, to report that WHO again showed leadership.
Really?
In really ensuring that countries put in place programs to resuscitate what we would call the essential health services.
But there's a divided opinion on that, Prof. You know that many have accused the WHO of not rising to the occasion, supporting the world, especially for those in the global south. How do you, react to all of these criticisms facing the organization?
Let me give you some examples. For example, in the area of what I would call developing rapid capacity for people to respond to these diseases. If WHO was not there, I can assure you there wouldn't have been a coordinated response in countries, but also development of capacity for health workers to know what this new disease is and to respond to it. Because the guidelines that countries used were developed by WHO. How to manage, for example, people in low economic settings, since we are talking of the global south. The WHO designed programs and guidance on how people at the lowest level of care could safely manage COVID patients without they themselves getting infected. The talk around rapid exemption or cutting short the process of developing vaccines is because WHO has a system in place of evaluating dossiers of new products, medical products. That because of that, they were able to evaluate and confirm that most of the new vaccines and the new products that were going to be used were safe enough to be used in an emergency setting, which we were in. But also monitoring what was going on across the world, telling the world we are seeing increasing cases in the global south. We are seeing emergency of variants. That was WHO that was coordinating that. So if WHO was not there, we would have been in a worse situation. And I think I still stand by the fact that WHO did a commendable job and showed leadership.
The elephant in the room now is about vaccine production. We'll get there shortly, but there's still uncertainty about the future and what it holds for countries such as Africa. The World Health Organization announcing on May 5, for instance, the Director General indicating that the health emergency is over.
Yes.
Are we completely out of the woods when it comes to the COVID-19 pandemic?
Maybe let me explain briefly what the declaration of the Director General Tedros was all about. First of all, at the start of this pandemic, the World Health Organization, under what we call the International Health Regulations, these are globally binding regulations that countries follow in terms of international health, gives the mandate to the Director General of WHO to declare what we call a public health emergency of international concern. Meaning, by declaring that or saying there's a pandemic, the Director General is putting on notice all countries of the world to say the globe is under attack. We need to mobilize resources, both financially, health resources, to collectively respond to this threat, global threat that we have. Fast forward, 5th May, the declaration was to say that global threat, which, by the way, is declared by the Director General following advice from specialists from across the world. On 5th May, it was to say, can we scale down the global response? The disease is still there, but the level at which we were responding may not be necessary now, because we have, one, for example, new tools for protecting the population, like the vaccines. We know more about the virus than we did, for example. We know how it is spread, what we need to do to protect the population. And so the risk for having a global spread and global negative impact has reduced significantly. That's what Prof was saying.
The average Ghanaian, the average African, the average individual living in the world, of course, inference they're getting from the World Health Organization now is the mask is off, no more washing of hands, we're back to normal times.
No, the Director General did not mention any of those. If you look at the statement, the Director General is saying, he's addressing the global health community to say the risk, the level of the risk that we had at the start of COVID is no longer the same, and therefore it does not longer constitute a public health event of international concern, and therefore cannot be termed as a pandemic. We've had similar things. And if we go back in history, before WHO was born, we had what we call the Spanish flu, which was a global pandemic. It was a pandemic. But we still are having flu now. And so we are not responding in the same way as we were responding during the height of the flu pandemic in the early 20s. What we have said is, we've got to a point where we have enough knowledge, enough tools for us to be able to treat the COVID disease as we treat other diseases. You get COVID, you go to a health facility, you receive the necessary treatment, and of course, if you go early or you've been vaccinated, the dangers of you having significant disease is reduced. So that's what we are saying. And I think the message to my Ghanaian brothers and sisters is that COVID is still there. It is circulating. You can get it. But the system is not responding at the same level that we're responding when it was a new disease, because we know more about it, and you can receive the appropriate treatment in time, and you can survive from it.
So, Prof, if the disease is still with us, then it's leaving you with much more work to do. So what plans do you have going forward into the future with regard to COVID-19?
Well, the World Health Organization, in saying it's no longer a pandemic, still continues to support work around, for example, recovery from the pandemic. Like I mentioned earlier, a lot of health systems had sort of come down to levels that we've not seen for a long time. And so we need to work with governments to ensure that the health systems have recovered to pre-COVID levels. Specifically, if we look at antenatal care, that we would want the antenatal attendants to get back to pre-COVID levels and improve. If we look at immunization coverage, we want it to be above the 90s, for which Ghana was renowned pre-COVID. When we look at admissions and access to other services, we want people to be able to go into health services. So we've working with governments to really implement what we call the recovery plan. But then secondly, we know that COVID was just the beginning of many, many pandemics that may occur going forward. And we've learned that COVID is not just a human disease, that it can come from animals. And therefore, we have now what we're calling a One Health approach, which brings together a multiple sectors, such as the veterinary, the animal health, to work with the human health, to be able to say, look, can we have early warning indicators? If you are a farmer and you start seeing your animals dying from unexplained illnesses, can we capture that information and send the relevant veterinary services to go and investigate? Is this a disease that is likely to cross into human beings or other species? And if it is, what can be done immediately to put in place measures that will prevent the spread of that disease? So really getting ready for the next pandemic is also the work that WHO is doing. And then thirdly, we've learned from the pandemic, the COVID pandemic, that there were what we would call equity issues. Vaccines were produced. Precisely. The southern part of the world, or the where we live, were the last to receive the vaccines. Yeah. And so there is now, as we speak, what we are calling a pandemic treaty that is being prepared. And this pandemic treaty will bring the lessons from the COVID pandemic to bear, that countries will sign off to say, should they be the next pandemic, there will be equity in the distribution of some of the medical products that are right.
I'm sorry, Prof, but that's where the global south is getting impatient on the capacity to, first of all, produce the vaccines on their own, and to address the divide. Why is the World Health Organization failing to intervene in this matter?
Well, that's how it is intervening, by bringing this pandemic treaty, because some of the things within the pandemic treaty include access to intellectual property, that during pandemics this should be suspended. And once countries sign up to that, immediately there is a declaration of a pandemic. We hope we can then have transfer of technology, for example, to countries such as Ghana, to be able to locally produce some of the products that will help respond to the pandemic. So the treaty itself has so many questions looking at issues of equity, the issues of intellectual properties, sharing of specimens to understand what is going on, and also looking at issues around how the pharmaceuticals can play a constructive role in ensuring that the products that they're developing, indeed at a high cost, are available to the global south and other countries of the world at a reduced cost compared to what it was during COVID, where some of the vaccines were in the hundreds of dollars, which was really beyond the cost that countries would
But what we've seen, for instance, in countries such as Ghana, bilateral efforts underway even before we have this treaty signed. We've seen the setup of the National Vaccine Institute in the case of Ghana, and we're just one of the very few countries on the continent doing that. What's the direct benefit of having these engagements ongoing, side by side with the interventions coming through from the World Health Organization?
Well, first of all, thank you. That's a very good question. And I must start by commending Ghana for really taking the lead in ensuring that the lessons from COVID-19 are put into action. And the creation of the National Vaccine Institute is one such action. What it means is that Ghana is taking the bull by its horns to say, we are not going to be the receiver. We are going to be the provider of some of these expertise and products and commodities across Africa and across our own country, Ghana. So on our part as WHO, we are contributing to the implementation of the National Vaccine Institute work. And some of the things that we are also doing is reaching out to some of the partner private sector entities to, amongst others, one, ensure that the private sector implement what we call good manufacturing practices. And so we've had, for example, visits from experts from WHO to some of the private pharmaceutical sectors here in Ghana to look at their production. Does it meet what we call the good manufacturing practices? I say so that because in selling some of your products across the borders, if you're not implementing good manufacturing practices, the benefactors from outside may not want to buy that. But then secondly, WHO has also what we call WHO pre-qualification process. The pre-qualification process allows for WHO, for example, to look at the dossier of what you are producing, medical production, and say that we can vouch for this commodity, that it's a commodity that is safe, that is produced at very high manufacturing or good manufacturing practices, that all the processes for manufacturing have been observed, and therefore, as WHO, we put a stamp to say it can be sold to any country. What that also happens is that these big funders, for instance, like Gavi, who fund most of the new vaccines, can buy those vaccines from your company for distribution elsewhere. So it is a process that in Ghana, we as WHO are supporting the Vaccine Institute, but also working with the private sector to ensure that what they produce is not just going to be for Ghana. And the benefits for Ghana having the technology and the skills to produce vaccines and medicines should not just end within the confines of our borders, but we should also have our sister countries benefit from that capacity that Ghana is trying to build.
Another peak of the pandemic, Ghana played a leadership role when it comes to the Vaccine Alliance, for instance, the Gavi initiative that you're talking about.
Yeah.
Has that died down, or you're still keeping that approach up even as you pursue other forms of solutions?
Yes, Ghana has always played a very constructive role in multilateral organizations, including our own WHO. I must mention, for instance, that in December this year, we're going to have the Gavi board meeting here in Ghana. Right. And that's because Ghana sits on that board. And so the influence of Ghana in, for instance, getting Gavi and other partners to set up what we now refer to as the COVAX facility, so that the Global South can access vaccines for COVID, is commendable. That Ghana really played that role in trying to get the different partners come together.
In terms of funding, or?
In terms of raising resources to put in the pool to buy these vaccines, which are now being distributed to countries of the South. And because they were members and are still members of the Gavi board. So it's important to note that. And then, but secondly, going forward, WHO is saying thank you to all the initiatives that, and the bilaterals included, that brought in vaccines. But we are going beyond that and saying, look, time has come to open up new avenues where these products can be produced locally. And that is through technology transfer, capacity building of the manufacturing industry to be able to produce quality products. We think that is more sustainable in the long term. Not only because we will have access, but the fact that if we are faced with another pandemic like COVID, they will require quantities across the world to distribute to fight that thing. And you saw during COVID that because of the limited pharmaceutical capacities across the world, we could not flood the world with vaccines that we needed. It took long for production to really ramp up. But if we already had production taking place or capacity existing in more than just 1 or 2 or 3 European countries, we would have seen a rapid ramp up in the production of vaccines and other products that were used to respond to COVID. And that's what we're saying, that this technology should not just stay in the global north, but should come to even those countries that during pre-COVID did not have the capacities, so that they can have that inherent capacity to respond to emergencies such as COVID.
Prof, the world is not just impatient about vaccines, but also treatment or medication. That became very topical, at the height of the pandemic. Now that we know research is continuing into, you know, the traits of the virus and how it behaves, have you gotten closer to a point where there's going to be an approved medication for treating the virus itself?
Well, there are some medications that were approved for use in emergency. And there are quite a number of what we call antivirals. And most of them were used in what we call critical cases or serious cases of COVID. Patients that were ending up on ventilators in intensive care were receiving some of these drugs. But again, the production capacity was not large enough for those particular medicines to be distributed widely. But we do have drugs that have been developed that are now known to modify the seriousness of the COVID case, especially those that are afflicted with what we call respiratory challenges during COVID. And I think going forward, what we could still push, just like with vaccines, is that these particular technology be transferred to additional countries so that production can be ramped up, and also that research and development becomes part and parcel of running a health system.
I'm asking the question because of the unique case we find ourselves in here in Africa and in Ghana, where, you know, the non-orthodox space, the herbal medicine, and other people claiming to have done research work and to find a lasting solution to this virus. I'm sure you've seen some of these advertisements online as well. It's becoming a source of worry as to how standardization from the World Health Organization could deal with that. Are you worried about it? How are you tackling that as well?
We are concerned. I think there are so many products that came online, on internet to say had been discovered for use. Specifically in relation to traditional medication, WHO has a program that focuses on traditional medicine. It really tries to set standards on how these products can be investigated, how they can be packaged, how they can be used to address some of the symptoms or diseases that we have. And working with the Ministry of Health, which also has a traditional medicines department, we've been able, for example, to have access to areas across the world where traditional medicine is a part and parcel of what you'd call orthodox medicine. And in fact, recently, if I'm not mistaken, there was a huge meeting which Ghana participated in I think it was Indonesia or Singapore, where the issue of traditional medicine was center in the discussion and people shared experiences. What we need to do now going forward, and this brings me to the question of research and development, is that we need to have capacity here to evaluate some of the claims that come through traditional or herbal medicines. Indeed, herbal medicines have, in our history as humans, have played a significant role in saving lives. I think what we need to be doing is to be saying, these products, this tree, these roots, the name is this. The active content is this. The concentration that we need for it to treat this disease is not just any cup. It is this size of a cup. And when you see that you start developing these side effects, please, it's probably that the level or the concentration is high. So that kind of work is needed. And I know in Ghana there is an institution that is working on that. But it needs support, it needs resources so that it can go across the country to develop that network where they receive these herbs, test them, advise the herbalist on how they can be used and what they can be used for. That way we're going to develop a very strong traditional medicine system in Ghana.
Right.
China, India, if you go to these countries, you have options when you walk in some of their health facilities, the equivalent of the kolebus. You have an option. There's inter-referral between traditional medicine and the orthodox medicine. Yeah. It's because they work together. The science that brings them to working together is the same.
Yeah.
And so that's our wish as WHO, that going forward, countries will pay attention and support the understanding of traditional medicine.
Prof, in my conversation with you, it's evident that COVID-19 has affected not just what we know on the surface, but the entire issue about ensuring that there's access when it comes to healthcare for all. Let's talk about the national picture, because we know there's a direct bearing on how that has affected, for instance, mental health and other related issues, which we'll talk in detail about. But the national picture, how bad has been that effect of COVID-19 on a country such as Ghana?
Well, I'll start that by saying that, you see, Ghana has been fortunate that compared to other countries in Africa, it moved fast enough to mitigate significantly the negative impact of COVID on health. And why am I saying so? I think when COVID started, Ghana was one of the 3 countries in Africa that almost immediately had capacity to diagnose COVID. They had the laboratory capacity to be able to say, this is COVID. They were able to say, this is the new variant of COVID. That helped in planning what to do and where to go in terms of the response. The creation of various coordination mechanisms in a timely manner also brought together the different sectors, allowing for instance, information to flow to the community, allowing workers across the country to understand the issues of COVID in terms of how it is spread, allowing for rapid use of masks, rapid use of sanitizers. It's that information spread that really played a significant role in mitigating the impact. But lastly, the health sector also responded. And really, if you look at the health workers in Ghana, they must be commended for really standing out and saying they were going to put their lives in front as they were responding to COVID. And I would like to really take a hat off and really to say, pass my condolences to those that died in the battle of trying to respond to COVID in Ghana.
But there are associated problems that we're still facing.
Yes.
The issues about mental health, for instance. It's now becoming very topical within your space here, the World Health Organization, the country office here in Ghana. Yeah. Why is that of importance to you, and what are you seeking to achieve with this new campaign?
Well, you see, mental health is what I would call a forgotten area of work in terms of health. If you and I visited mental or psychiatric hospitals, it's in many cases you'll find it's one of those run-down facilities with poor services. Yeah. And it's not only in Ghana, it's across Africa that mental health has been linked with a lot of stigma. From witchcraft, from being cases, and so on. But we know that mental illness, in many cases, most of the mental illness can be managed or even prevented. For example, we know that substance abuse contributes to mental illness. Mental illness also runs in families. Stress, depression, and external stress that we saw, for example, during COVID, can drive people into mental illness. Losing a job can drive people. So we are looking at mental health as really, yes, and a forgotten thing, and that COVID has taught us that can we also look at the new diseases. And because of that, the Director General of WHO set up what we're calling the Mental Health Initiative, which was supposed initially to be rolled out in 12 countries in Africa, of which Ghana was one of them. And so our work now is really to partner government, partner the health workers, partner the communities, but also partner the civil society in saying, one, let us look at mental health as an ordinary disease that can be managed. But to manage it, we need to put in place systems. For example, at the primary healthcare level, the chief's compounds, the health centers, they should have that capacity to manage mental health diseases. And that's why we want to develop that capacity, train people along with the different councils and also the mental health council to have that capacity near to the community as possible. To have a referral system that not only refers people to the hospital, but also sends them back to the community where they know they'll be treated and receive the support that they need. To ensure that the medical products for mental health are available at all levels of care. And of course, to also get acceptance within the community that mental health is something that we need to look at and accept as a normal health challenge.
But is this being driven by data? And what problem are you seeking to tackle here in Ghana?
It is. In Ghana, for example, out of the population of almost 30 million plus, it is estimated that almost 2.3, 2.4 million people have a form of mental illness. That's not a small number. And if you're looking at that number, why are we not investing in ensuring that those people receive the appropriate care? So the numbers are there. It's huge. 2.3, 2.4 million people with a form of mental illness.
And that's just the documented one.
That's the documented one. That's the estimated one. Because I must mention here that mental illness is not just what we see people working on the streets. Mental illness can be as subtle as what we call in our community, that's a difficult person. Oh, he has anger issues. We take it as normal. So, oh, no, just he has anger issues, so just avoid saying that. And yet that person, if they have access to mental health services, they can go and meet a qualified psychosocial person, a psychiatrist, and so on, to sit and have a lengthy discussion. Why is it that when somebody calls your name, your response is a thing? To understand that. And that's what we're trying to do with this initiative, that people should understand that we can build capacity for people who we assume are difficult people to be able to access those services, to understand why is it they are behaving like that. Then, of course, you have the extreme. Those that require initial stabilization in health facilities before they are sent back into the community. They need regular medication. And some of the medication are given once in a month through an injection. Yeah. So people have to support them in the community to let them go back to the health center to receive the medicines and not abscond of medicine. Because once they abscond, they will then relapse and go back into their old disease.
Would you say that after this program that you're running, structural issues would have been dealt with? Because the challenge is enormous, and you agree?
They are enormous, but our investment in this initiative is to ensure that we bring it to fore. People start discussing around it, that governments, partners start putting money into mental health. The systems are there. For example, now we have systems that are going right up to the community. We have the council that we are working with. We have the civil society we are working with. Each of them is contributing in a way in ensuring that this initiative and other initiatives that will come continue, that they're sustainable, and that whatever we put in place continues to be operational. So yes, I think going forward, we're going to see better mental health services, but it's really all of us, including the media, that we need to really promote and advocate for these services to improve, just as we have advocated for other services like antenatal services, vaccination. Those services are there. Why can't we advocate for mental health, considering the numbers I've given you of 2.4 million people?
And Prof, when that comes up, why do you feel there's always that lukewarm nature towards embracing real issues of mental health? Very often when the conversation comes up, it's not as embraced as other topical issues within the health sector.
Yes, I think it starts with the community. Within the community, let me tell you, when I was growing up in my country, Zambia,
right,
we would go to the village and we could see cousins, neighbors who had children or even adults that had manifesting a mental illness. And the story in the community is always, oh, that family is cursed. So our traditions sort of dampen what we would call the normal response that you give to diseases. Because we have explanations for mental illness in our communities. And that's why we're saying, working with the community, working with the civil society, we should be start breaking these myths. If these myths around mental health are broken, it will become just another disease. We lived, when I was a bit younger, we lived in an era of HIV. People never spoke about HIV,
right,
but in whispers. Why? There was no medicine, there was no system to really run HIV service. But when medicines became available, when hospitals opened up for HIV, nobody talks about HIV as the way we used to talk about it, or people used to talk about it. People have come to realize that it's a chronic disease which can be managed. It's the same with mental health. The area we accept that this is one of these chronic conditions that need to be managed, the better. Because some of the things that drive mental health need also to be managed. And some of them I mentioned earlier. Substance abuse, the pressures from our offices. We need to have some staff well-being programs in offices that will allow for staff that are under so much pressure to go and unwind. Because the divide between flipping, as you call, is neither here or there. That it's somebody is put under so much pressure at work. The next thing you see is that they're depressed. And depression, by the way, is a form of mental illness. Stress is another form of mental illness, exhibiting stress. So we need to be addressing this holistically. And if we can do that and accept that these are conditions that can be managed, then we'll be seeing better investment.
So I see that there's the role for the citizen, there's the role for the lawmakers in terms of dealing with structure. There's also the aspect about human resource. And that's a very thorny issue that we need to look at. The fact that most of our health workers do not seem to be patient enough to still work within our system simply because they feel the structures are not there. And that's coming up to this whole conversation around brain drain. The fact that we don't have the finest brains on the continent being retained to support some of these initiatives that we're talking about here. Why are we seeing this massive exodus, if you want to call it, of health professionals from our system?
It's a very good question, and I can take you back to my own experience. I left my country to join WHO. So maybe we should refer to it as brain circulation rather than brain drain, because as long as you are helping a human being, I think that is a primary responsibility of a health worker. I think the tag of saying where the brain drain is, you retain your brain, you go and help other human beings. But that's a discussion for another day. But to come back to your point, it is worrying that in Africa, specifically in Africa, where the numbers per capita of health workers is low, that we are losing not just health workers, but but we're losing the experienced health workers for quote-unquote greener pastures. This is an experience that has had what I would call kind of a circadal movement. As it goes up in countries, comes down, and so on. And it's related to many, many factors, not just monetary. It is related to the quality of the facilities that our health workers are working in. It is related to where you are posted to work. If you are a young gentleman recently married with a 3, 4, 5-year-old child who needs to go into primary school, into nursery, and then you are posted for a long period of time in an area where there is no nursery facilities, you start feeling that, oh, you're being punished. I mean, I've gone through it. You feel like you're being punished. And that's why WHO, for instance, through different World Health Assembly discussions, has come up with guidance on how to sensibly manage health worker migration, especially to what I would call the developed world, because that's where most people are going, or to countries that are able to pay better salaries, but also offer better working conditions in terms of where you are working and so on. And this guidance specifically encourages two things. One, discussions between recipient countries and countries that are losing the health workers. And this discussion is really about how can we contribute to retaining health workers within the country? Or if they go, how can we get external capacity to come and build the same capacity that has left? So that discussion has to take place. The bilateral discussion between countries on this have to take place, under the guidance, of course, of the different guidance that WHO has given. Internally in a country, how can we work with partners, with government, with civil society, to improve the conditions, including the communities, to improve the conditions of our health workers? I visited recently Volta region and Oti. And in one of the towns or chiefdoms I was invited to, the community has taken the responsibility of starting to build health worker houses. Okay. They raised the money. They have a health facility. They looked at it and said, look, if we do not have accommodation for our nurses, for our physician assistant, these young people are going to leave. So they've gone around, they were almost completing the facility. And this is what we are saying, that the retaining health workers in your community is not just a government responsibility, it's also a community responsibility. I would want to have as near to me as possible a health facility, so that when I have malaria, I know I can be taken there and there's a health worker to treat me. So it's a combined effort of trying to retain the health workers, but at the same time also giving incentives.
But it's not yielding results. We just need to tighten our laws, more stricter regimes for all these people.
You can't stop people from traveling. Right. It's virtually impossible to stop people from. And health workers, by the way, are not the only people that are traveling out. If you visit the United Kingdom, you'll find Ghanaian teachers. They are not going maybe at the present time at the same numbers. Right. You find Ghanaian professors teaching in these universities. So it is a human resource problem, and not necessarily just health workers. And that's why I was coming to say we need to look at it as a country in a broader context. Our universities are producing a lot of graduates. How can we get these graduates absorbed, develop capacity, so that we get to a stage where even if 1,000 doctors, nurses left today, you still have another 1,000 with the same capacity to replace them. So it is planning. We need to develop what we would call a migration strategy, which will look at the inputs, that's the human resource coming in, how do we develop their capacity, how do we use the recipient countries to bring their experts to train these newly qualified nurses, newly qualified pharmacists, to develop the relevant capacities that we need in them to run services, while allowing for those that have served their country to also have an opportunity to go and work elsewhere. So people know, if I work in Bogatanga for the next 5 years, I'll have an opportunity to develop my skills, and that if I want, I can move either internally in Ghana, or I can be part of the team that will go to support or work in Barbados. It is managing it that is important. And if we can manage that by having a migration strategy which clearly develops or defines the different components of the living, those that come in, the developing of capacities, the rotation within countries. And by the way, it's also the distribution within the country. There are some parts of this country that don't have enough. Yeah. There are others that have excess. So we need to see that migration and human resource strategy should be looking at that to say, how do we ensure that per capita there is X number of nurses, X number of doctors, so that we do not have everybody in Kolebu or in Kofonochi or in Takoradi. That people need or to see these health workers as close to them as possible.
Prof, we need to go, but we're still in the mood of celebrating 75 years of the World Health Organization. What are some of the activities that will be coming off in the coming days from your office just to mark the celebration?
Well, thanks again. The celebration is going to go on until the next year, 7th April, which will be the World Health Day. And what we've been doing over the last couple of months is really trying as much as possible to make visible the work of WHO in Ghana and beyond. We have, for instance, been celebrating almost every month what we'd call a health day. And last week or 2 weeks ago, we all had gathered, including the ministers of health in Gaborone, Botswana, to recognize those Africans that have contributed to global health. And I'm happy that Ghana, Ghana's own son, Dr. Anafi Asamoah Ba, was recognized at that occasion. Wow. And that occasion also recognized former heads of states for their work in health. So you can see the level of recognition. He was recognized specifically for his contribution to global health and his work in ensuring that WHO is what it is today. So I'd like, on behalf of all of us, to congratulate him and Ghana for having produced such a brilliant son in the name of Dr. Anafi Asamoah Ba. But going forward, we have a number of activities planned. Next month, we are gathering in Oti to celebrate, guess what? Mental Health Day. Oh. And during that celebration, we want again to try and promote the work around mental health. And we're inviting a number of partners and communities, including joining the Ministry of Health in celebrating Mental Health Day in Oti. At the end of this month, we have what we call the Walk the Talk. This is really to promote healthy living. One of our pillars is really to, as I mentioned, is to save the vulnerable. And the vulnerable are really the community who must understand that health goes beyond just going to the hospital and getting that. So we're trying to promote a walk, 6-kilometer walk, starting from the forecourt of the State House or Jubilee House, to just promote that information. And again, all of you are invited to come and join us. We also have partnered the National Health Insurance Authority in bringing together end of next month, in bringing together a significant number of what we call health insurance authorities across Africa to come and discuss and review the role of health insurance, government-run health insurance, in supporting quality health delivery. So there are quite a number of things that we have lined up, and I hope that on 1st December we'll join the HIV World in celebrating the work around HIV, not only in Ghana but globally, but also to talk about new tools that have come into being in terms of managing HIV. So we're still there, and we'll keep informing you on
It's indeed a very
things.
packed moment for you, but we say on that note that let the celebration continue. Thank you.
Thank you very much, and we look forward
Indeed.
to continuing discussion with your Joy TV, and continue the good work that you're doing in really educating the population on issues of health.
And we also say happy anniversary.
Thank you very much.
Thank you.
Thanks.